This is Ms. Kubian. We're going to go into some more medication administration today. We're going to talk about injections. We're going to talk about intramuscular. Okay, by definition, we're entering into the muscle. We're going to talk about subcutaneous injections, which is going to be into the subcutaneous tissue. And we're going to show you what needles we use and how we go about that. So we're going to start with subcutaneous, okay? So first of all, when we're giving a subcutaneous injection, we have to think through several things. For one thing, let's go through our 6 medication rights, right? Before I give any medicine, I need to do that. So let's talk through that. What's our first one? Right patient. Can you tell me your name?
My name is Brandy Mobley.
Okay, Miss Mobley, can you tell me your date of birth?
1/11/1984.
All right, perfect. So I've got the right patient. All right, then I want to make sure that I've had the right medication. All right, I've got my patient, I've got my right medication, so I wanted to make sure the doctor has ordered for Brandy Mobley to get a subcutaneous injection today. She's going to be getting a Lovenox injection, so I want to make sure that I have the right drug, so I'm going to look at mine. Now in the hospital, Lovenox is going to become in a pre-filled syringe, okay, which we'll be pulling out of the Pyxis, but for the sake of this video, we're going to show you what that would look like with just the syringe, okay? So I'm going to be giving her a subcutaneous injection. I make sure that I have my Lovenox, I've got my right medication. All right, we talked about what is next, the right route, okay? So we talked about that. How am I administering this? Into the subcutaneous tissue, right? So that means that I need to know where that is, okay? So location is pivotal when we're giving injections. So let's talk about subcutaneous. There's several locations that we can give that. We have behind the arm, so I'm gonna let Miss Mobley kind of model. So right here, and that right between here is kind of right between. I like to go somewhere in the middle. It just makes me know that I'm in a good spot, okay? When we're old ladies, that's where we get that nice little lovely skin right back, that sagging skin right there. So we have there, okay? And then we can move into the abdomen. All right, so usually we learn that you can kind of get a fist and we go around the umbilicus. So we have our abdomen, okay? And we have the love handle section, which makes us feel great, doesn't it? And we're gonna give you a shot of your love handle. All right, so we have the love handles on the side. And really now they prefer for us to give a lot of our injections in that area. Okay, so we have that, and then we also have the thigh, okay? So those are several locations that we can give a subcutaneous injection. One thing that's really important is when you're giving a patient an injection, think about, one of the things you want to think about is where would maybe be the best location for this specific patient. My 85-year-old, 90-pound little lady is going to be a little bit different than my 250-pound, 20-year-old male, right? It's going to determine where I maybe give that injection. The other thing is going to be hospital policy and medication policy where they would prefer for that to be administered, okay? So let's talk about another subcutaneous injection since we're here. Let's talk about insulin. We give insulin subcutaneously, okay? One of the big things that I always tell my students, and one thing that's very important, if Miss Mobley has been taking and giving herself insulin for the last 15 years, what can I do that would maybe make the procedure a little bit better for her? Miss Mobley, where do you like to give yourself your insulin?
I usually do it in my belly.
Okay, well, I'm gonna give it to you in your belly then, okay? We love to prance in and say, I want to give you your insulin and shoot into the back of the arm. But well, if that's not where they normally like to give their insulin, ask the patient first, okay? Where do you like to get your insulin, okay? And then I'm going to find out maybe if she's been in the hospital for a couple of days, but she's new to me, I'm going to maybe ask Miss Mobley, let me look at your stomach. Do you remember where they gave you your insulin earlier today?
On the left side.
Okay, well then I'm going to look over and we're going to come over to the other side and give that insulin, okay? Why do we rotate sites? What's some things that we might be concerned about? Well, bruising is one, right? So, and especially with our little and our more delicate patients, we really want to be conscientious of that. Miss Mobley could be on a blood thinner, she could have a whole lot of other things going on, and I want to make sure that I protect her in that way. So I'm going to be mindful of that and ask those questions, okay? So that's something to think about. Lovenox, since we're talking about Lovenox, that's an injection that a lot of patients will get every day they're in the hospital, okay? They may even have to go home and maybe give themselves these injections, but that's one reason that I want to, big thing you're going to hear is rotate sites, okay? So ask the patient. If you can't tell where they got it, ask the patient, okay? And if they are not able to answer that question, be mindful of that as you're looking at the location site that you're going to administer that, okay? Lovenox and those injections, we are going to maybe aim more for those, the love handles. We're not going to give Lovenox in the arm. We're going to give that somewhere, love handle, or some hospitals are still allowing you to give it in the abdomen. But make sure that you know where it needs to be given, okay? So we're going to give her a subcutaneous shot. So we've decided we're going to give it to her in the abdomen, okay? So I'm going to make sure, as always, that I'm going to be washing my hands as they come in the room. I'm going to be touching my patient, right? So I should have washed them before I came in. And then I'm going to be putting on some gloves. I'm going to be donning on some gloves since I'm going to be touching my patient, okay? So when I step over to Miss Mobley, I've found my site, I've gotten my gloves on, and then I'm going to, if she hasn't had this injection before, guys, always explain this to them. You know, nobody wants to be stuck, okay? So explain the procedure, why they're getting it, why are they getting a Lovenox injection. Hopefully they know why they're maybe getting their insulin. But I'm gonna go ahead and get the patient in a comfortable position. If you're giving something to somebody in their love handle, it would be most comfortable to lay them over to the side that is not receiving injection, okay? So I'm gonna get Miss Mobley to roll over to her side, and then with a Lovenox injection or with subcutaneous injection, couple things about needle size, okay? As you can imagine, we're going into the tissue. Do you think our needles are gonna be small or big? They're gonna be a lot smaller, right? Because we're just trying to get into that tissue. So most of those are gonna range between 25 and to 27. Okay, so they're going to be smaller. They're going to be smaller needles. So I'm going to have my alcohol. I've got my gloves. I'm going to make sure, as always, we're going to clean that site really, really good. Okay, so I'm going to open my alcohol. I'm going to clean that site really, really good. Okay, make sure you're putting some pressure in, and then with all alcohol, let it sit for a second. Okay, all right. Have your stuff prepared. Big thing that I tell you with needles. You need to be comfortable with them, okay? So that when we're going in to give our injection to the patient, make sure that you know the angle your needle is supposed to be at, and be comfortable with that when you're going in, okay? With the subcutaneous injection, we need to make sure that we're getting that skin. We're gonna be pinching some skin together, okay? So my hands are gloved. I'm gonna get my skin together. Now here's a problem with if we were doing, is that I wanna make sure that before I remove the cap, make sure that I have everything, that my dosage is right, that I've got everything prepared before. Once again, I always do that second check before I'm going to dart the medicine, okay? So I'm going to make sure that I've got my Lovenox syringe ready. I'm going to take the cap off. I'm going to pinch the skin, okay? And with these, you can do these at 45 to 90. I, as a rule of thumb, usually just give mine at a 90, okay? So you're going to take it, you're going to dart it, and you're going to shoot it, and you're going to remove it, okay? Most of the Lovenox syringes will have a safety so that you can push it up. Okay, so make sure you've done that. And if for some reason it's not working, something's wrong with it, this is gonna go where? Into the sharps container anyway, okay? But after I've released that, be mindful. I like to a lot of times even have a 2x2, which is those baby gauze, because some of your patients that are on blood thinners will even bleed, even with a subcutaneous injection. So make sure you have that prepared before you leave the site. Make sure there's no bleeding. If it is, just kind of make sure you put a little pressure there and get that to stop before, okay? Because that's going to also could cause a hematoma, increase some bleeding for that patient, okay? After you're done giving the injection, we've put this in the sharps container. We've taken our gloves off and washed our hands. Just once again, assess your patient. Make sure there's nothing after you've given a shot. Make sure that it looks okay. I always usually recheck it. Make sure everything looks okay. Make sure your patient is comfortable, okay? So that's our subcutaneous injection. With insulin, you want me to also give insulin subcutaneous? Sorry. Okay. All right. So the same thing is going to serve for insulin. Okay. In hospitals there's a different ways that insulin is administered, and depending on the hospital. Okay. So if you're at a place like UAB, most of them are going to come in a pre-filled syringe that's actually going to be given to each patient when they're admitted into the hospital. So they will actually be given their own syringe that nurses will be continuing to use as long as the patient is in the hospital. Other facilities are still drawing up insulin, okay? Is insulin one of those that I want to have another nurse check on? Yes, okay. Is insulin a scary drug? Yes. I always tell people, so your insulin syringe is always going to be orange. I always tell students to remember that, because orange makes me it's a brighter color. It makes me think this is not something that I need to be mindful of, okay? So when you draw up your insulin, you're always going to, once again, go through all of your medication rights, but you're going to always want to get another nurse to verify that you have the correct dosage, okay? Units of insulin, or if you give a patient too much insulin, can we kill a patient? We can, okay? It's a scary drug to give. So, and once again, we already went through where that's given. That's given subcutaneously. So I'm going to draw up my insulin, okay? So I'm going to have my insulin drawn up, kind of just pretending to do this, okay? And we don't, insulin, because it's something that we give such a small dose of, that's why we want to have somebody recheck it, right? So that when I'm drawing it up, that I have someone else checking that, okay? So you can see this is a tiny syringe. And what do we give insulin in?